Hey guys, welcome back to Medical Coding with Blue. It is Vlogmas Day 9. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. This year for Vlogmas, I am doing the whole series on modifiers. So if you haven't had a chance to check out the other videos I've done so far, I hope that you will check the playlist in the description box below, which will also have the websites that I'm using for today's show. And I'm going to start off by reading from the CPT Professional Edition by the AMA. The Appendix A is going to have some definitions of some of your modifiers. Today's modifier is modifier 53 for discontinued procedures. So here we go. All right. Modifier 53. Discontinued procedure. Under certain circumstances, the physician or other qualified healthcare professional may elect to terminate a surgical or diagnostic procedure. Due to extenuating circumstances or those that threaten the well-being of the patient, it may be necessary to indicate that the surgical or diagnostic procedure was started but discontinued. This circumstance may be reported by adding modifier 53 to the code reported by the individual for the discontinued procedure. So from reading that, we know that this 53 will not go on evaluation and management codes. It is only going to go on procedure codes. All right. So reading from the NOVITAS website, because we all know how much I love NOVITAS, their NOVITAS modifier 53 fact sheet, it goes like this. Appropriate usage. Unusual discontinued circumstances. A discontinued procedure after induction of anesthesia. Append the modifier to the discontinued procedures CPT code. Okay. Inappropriate usage. To report the elective cancellation of a procedure. Procedure discontinued prior to the anesthesia being induced. Note, consult modifier 73. I will cover that in another episode. When used on E&M services, so again, it does not go on evaluation and management codes, or for outpatient hospital / ambulatory surgical center. Supporting documentation. Additional information to support the modifier can be written to the narrative of the claim. If data cannot be written into the narrative, documentation must be submitted. Supporting documentation should state when the procedure was started, explain why the procedure was discontinued, and notate the percentage of the procedure that was performed. Now, I mentioned this yesterday about modifier 52, right, for reduced services. The difference being is that anytime that you have a special situation like this, where you're going to have to apply modifier 53, the insurance company needs to understand what happened so that this can be paid appropriately. You know, they have their formulas and how they do things. So just make sure that you educate your provider that anything that they're doing, it needs to be documented to the full extent that it was complete. Even if it was not complete, they need to know how much of that procedure was completed. All right. That is very important because it's that little detail, and it's that little detail that's going to save you from other headaches. All right. And reading on from CARECLOUD.com, which is another website that I love because they talk about these modifiers. They did a whole modifier series as well themselves, which I love. And I'm going to go ahead and read from this. So here we go. Defining modifier 53. As noted earlier, the qualifying discontinued service codes for modifier 53 are very specific. CPT Appendix A states, due to extenuating circumstances or those that threaten the well-being of the patient, it may be necessary to indicate that a surgical or diagnostic procedure was started but discontinued. This circumstance may be reported by adding modifier 53 to the code reported by the physician for the discontinued procedure. Circumstances for applying modifier 53 would not include a change to the procedure that was planned or expected by the provider. So first and foremost, you'll need to know why the provider decided to cancel the procedure after they'd already begun. Another important thing to note is that modifier 53 should be used after surgical prep and or anesthesia is administered, hence discontinued, which indicates that the procedure was started in the first place. To help illustrate when the applicable situation could arise, let's look at examples of modifier 53 in use, which is why I love this website, because they give really good examples. Clinical examples, correct use of modifier 53. Example 1. The patient is seen in the oncology office for treatment of menorrhagia, and the physician decides to do an endometrial biopsy. When the provider attempts to perform the biopsy, however, she's unable to carry it out due to the risk of uterine perforation. In this scenario, the doctor would bill 58100 with a 53 modifier to indicate that the biopsy was started but aborted because of the threat to the health of the patient. Example 2, a provider a provider starts the procedure for a colonoscopy, but is unable to advance the colonoscope to the proper location due to poor colon preparation. This provider bills 45378 with a 53 modifier to show that the procedure was started, but unable to be fully performed due to extenuating circumstances. So you will see this occasionally in these types of situations. If you code for colonoscopies, I've coded for colonoscopies before, and I've seen many instances of this happening. So yes, I get it. And I was like, that's a very good example, because yes, that is very true. Example 3, a surgeon has a patient under anesthesia and fully prepared to proceed with the surgery. However, the physician cuts himself and therefore cannot carry out the operation. Modifier 53 may apply to the surgical CPT code to indicate an extenuating circumstance that prevented the procedure from being performed. In this scenario, the surgical prep and anesthesia indicate that the procedure had already begun but had to be discontinued. And now this is something that can potentially happen. I mean, if the surgeon cuts himself, I mean, obviously this is no longer a sterile environment, right? They have to stop the procedure. So that is something else. That is another really good example of using modifier 53. Very good. Very good example. When not to use modifier 53. Modifier 53 would not apply for elective cancellation of a procedure, discontinued surgeries prior to anesthesia or surgical prep, evaluation and management, again, like I said, or time-based codes such as critical care. Okay, so that would not apply to modifier 53. And then remember your supporting documentation. Payers are very likely to request supporting documentation when you attach modifier 53 to your claims. Detailed documentation will help you secure appropriate payment for the work you did. So remember to notate the following. They talk about this, all right? Each step of the procedure that you were able to complete, the percentage of the procedure that was performed, for example, 35% complete, all right? And then explanation of why you were unable to move forward with the procedure. Having this documentation complete and readily available for your payer to review can help you to receive reimbursement in a much more timely manner. It is about the details. I mean, we are in such a detail-oriented field, but sometimes it is difficult because these providers, they're not necessarily thinking about, oh, I'm going to use this modifier, that modifier. What they're thinking about is the note and the documentation. So this is why talking to them on a regular basis and explaining these things, and even if you have to do a really quick coding tip of the week where you talk about something like this, hey, if you have a procedure that this happened, this would be a good example of modifier, whatever you want to talk about. That is very good for them to know, because it helps them to get into that mindset of, oh, this is when I would do this, or this is when I would do this. You know, that is something that you can share and pass along with them, even if they're not the ones that are wanting to select those modifiers and it's you that selects the modifiers because you're the coder. At least talk to them about these scenarios where something like this could happen, where they have a discontinued procedure, or if they have a procedure where they're doing reduced services, you know, that, and thinking about modifier 52 on that one. So that would be something that would be very helpful for them. It's always nice to have that good conversation, because sometimes that conversation can spark other conversations, and that can lead to better documentation. So that is my message for today. Thank you so much for joining me, and I will see y'all on the next episode. Bye.